Hello, this is Dr. Owens from Texas A&M University, Corpus Christi in Corpus Christi, Texas. I am pleased today to join you to discuss ZIKA in the United States. Initially, when we first started to hear about the ZIKA virus, it really was not a priority here in the United States. We knew that there were cases across Africa and Asia, and that most recently we had seen them in South America. But still, it wasn't considered a risk in the continental U.S. We did have some cases in some of our United States territories, such as Puerto Rico, the U.S. Virgin Islands, and American Samoa. But scientists here in the mainland really only thought ZIKA would affect a small portion of our country, and that is the Gulf Coast region that runs from Texas to Florida. They also predicted that the number of cases would be in the hundreds. They didn't see it as a serious threat. As of 11 May, the CDC, or the U.S. Centers for Disease Control and Prevention, had confirmed 503 cases of ZIKA in the continental U.S., but they were all travel associated. They did not see any evidence that they were mosquito-borne cases. The ZIKA map in May 2016, you'll notice that for current cases, we were really looking at South America, Central America, and just a few areas of Florida. Of course, we did have cases in Puerto Rico at that time. The predicted spread was the Gulf Coast region, and that is the red area at the top of this map. It runs from Florida toward the west and culminates in Texas. That is what scientists were predicting. Currently, it looks quite a bit different. There are 11,351 confirmed ZIKA cases, and in the continental United States, there are 2,496 cases. The rest of them are in the U.S. territories of Puerto Rico, the Virgin Islands, and American Samoa. The first local spread of ZIKA that we have seen in the U.S. through infected mosquitoes occurred in late July in Florida, and that really changed the conversation that we're having about ZIKA in the United States at this time. If you look at this map, you'll see that the current spread looks quite a bit different from the previous map. We are seeing cases in almost all of our states. The only state, there are two states that are clean. Those are Alaska and Wyoming. But otherwise, we're seeing a goodly number of cases in Florida and Georgia, Texas, California, and the New York, Pennsylvania, Virginia area. As I said, most of these are travel-related cases, and so we're really not getting the support for ZIKA prevention and research that you would expect with a virus which shows the types of serious side effects and birth defects that we have with the ZIKA virus. ZIKA in the United States right now, when we talk about the continental United States, we're looking at 29 mosquito-borne, locally acquired cases. A little over 2,000 travel-associated, 1 laboratory-acquired case. 22 of these were sexually transmitted. In our U.S. territories, and the majority of these cases are in Puerto Rico, we're looking at almost 9,000 locally acquired cases. and 43 travel-associated cases. And this is very concerning, because if we can see this type of spread in Puerto Rico, and we know that we have the mosquitoes here in the continental United States, then there is a chance that we will see much broader spread than we are looking at this time. Florida is the area where we are seeing the first mosquito-transmitted cases. Initially, it was a 1 square mile area of a neighborhood called Wynwood, and they had started seeing cases which were travel related. Then of course we started to see the sexually transmitted cases, and then the mosquito-borne. Most recently we've gotten 2 more cases in Miami, and at the time when we started to see that, we began to get much more direction from local public health entities. We also have travel advisories in place for pregnant women to actually stay away from the Wynwood and Miami Beach areas. So this is the first time that we've seen travel restrictions within the United States. And that, of course, is out of concern that we are seeing our first group of cases where they are transmitted by mosquito. The belief is that the mosquitoes had bitten someone who had Zika from a travel-related episode, and then the mosquito became infected, and then the mosquitoes spread that virus. So the Florida Department of Health has identified 2 areas of Miami-Dade County, which is the Miami Beach area specifically, in addition to the Wynwood neighborhood where we first saw mosquito transmission. And so now we have mosquito-borne spread of Zika virus in a section of Miami Beach. What are our future concerns? Right now we have massive flooding across southeastern Louisiana and some other southern portions of the United States. And scientists are predicting that that could bring an increased risk for the Zika virus after the waters recede. Their concern is that mosquito eggs, which have already been laid in containers, areas where the water is still, could hatch after the flooding recedes. Now, we have 2 areas of concern here in the United States. One is the Zika virus, of course, but also West Nile. And a lot of our scientists at this point feel that West Nile is actually a bigger threat, but we don't really know. So the most protective thing that we can do is to try to prevent both of these mosquito-borne infections. The maps here show the CDC's best estimate of the range of the mosquitoes. The blue area, we're looking at Zika. The yellow area, we're looking at West Nile virus. So you can see that we have the potential for the spread of both of these mosquito-borne diseases throughout the southern half of the United States. Funding for Zika prevention, we have a real problem here. In June 28th, the latest Zika funding package went to our Senate, and it was not approved. Earlier this month, our Health and Human Services Secretary predicted that U.S. agencies who are managing the Zika response would soon run out of money. And just yesterday, President Obama started putting real pressure on Congress to fund efforts for fighting the spread of Zika in the continental United States and also in our U.S. territories. That is where we are right now. We're waiting really to see what the spread is going to look like in the near future, and hoping, of course, that we get funding to really allow communities to put protective measures in place to protect their populations from the Zika virus. Thank you for allowing me to address your class, and I hope I've given you a little bit of information on how Zika looks in the continental United States and in our U.S. territories. Thank you again. Good day.